Depending on the person's level of their severity of their addiction, that would guide what the recommendations would be from a clinician or an agency in terms of what type of setting that person should be in to best address what their issue is. So what we talk about is in terms of a continuum of care model and least restrictive setting models. So what that means is that if a person has a severe drug and alcohol addiction, they need a residential setting, an inpatient rehab, because their addiction might be so significant that doing it on an outpatient basis, and an outpatient basis means you're getting rehab treatment, but you're going somewhere anywhere from 1 time to 5 times a week, but you go home. For some people, if they're so close to the fire of addiction, going home alone may not be an ideal ingredient for their long-term recovery. So typically a person who has tried via outpatient, because that's the least impact, that's the least restrictive model, at least. So somebody might initially try to go to a therapist. A therapist is the lowest impact intervention. Once a week I'll go to a therapist, but I'm still getting high, I'm still drinking. Now the therapist might say, well, you need a higher level of care, which would be outpatient. Now you're going to outpatient 3 times a week, 5 times a week. Maybe you're going for 2 hours a day, maybe you're going up to 4 hours a day, but now you're still getting high, you're still drinking. Now we would say you need a higher level of care, which was inpatient rehab. And this continuum of care can go both ways. At the rehab, you would be then referred down to an outpatient when you leave the rehab. And then at the outpatient, if you've succeeded there for a period of a few months, you would get referred to see, let's say, a therapist once a week. So it's creating a safety net to address the intensity of your problem. The most intensive inpatient model would be something called a therapeutic community. Typically, a therapeutic community is 6 months to a year, and it tends to be for people who have tried a lot of the other interventions and they haven't worked. And these clients need a lot of behavior modification, a lot of changes. The old saying used to be with TCs that they tear the old person down to build them back up in a new healthy way. So a lot of this looks like, it looks pretty intensive. It looks, I used to call it cool hand Luke. It used to be a little bit of, looked a little punitive and a little aversive, and there is some of that because you have to earn certain privileges in therapeutic communities. So these are pretty intensive places, but they do also work for people who have that level of severity of a problem. Now, a new type of model of treatment that's developing now is also virtual or e-therapy. There's a phrase that we use in treatment called barriers to treatment. And so 2.5 million people sought treatment for drug and alcohol problems last year. But by some estimates, another 2.5 million people needed treatment but couldn't get to treatment. They didn't have child care, they didn't have the money, their job wouldn't let them go. So those are barriers to treatment that keep people sick, keep people drinking and drugging. So e-therapy has come along as a form of outpatient therapy for people with a moderate addiction problem that allows them to have group therapy and individual therapy via teleconferencing in the comfort of their own home.